Welcome everyone, and thank you for joining us for ACAM's April webinar. Today, we are honored to have Dr. Jerome A. Dixon presenting How to Impact Your Patient's Health Through DNA-Based Nutrition. My name is Cassandra Carlson, and I'll be hosting the webinar on the back end. This webinar is approximately 45 minutes, followed by a Q&A session. Moderating for us today is Denise Krebs. Denise is your DNA detective. As a certified epigenetic health coach, she empowers individuals to own their wellness journey by discovering their unique genetic code and learning how to make the best decisions for their personalized health. Her company, The Code of You, offers a rich toolbox to support businesswomen solve their mystery health challenges, focusing on genetics, detoxing, and hormone harmony. She is a Louisville native, married, and she and her husband are raising 2 children, aged 13 and 20. Her passion is to see women live their purpose that God created them to live and age with a lifetime of memories. I'll hand it over to Denise to introduce Dr. Dixon.
Well, good afternoon or good morning, I guess, out in the East Coast. It is my distinct pleasure and honor to be able to introduce Dr. Dixon to you guys today. He is our family's personal primary care physician and has become a dear friend and mentor to me over the years. And I still remember one of the early conversations that Dr. Dixon and I had, and I asked him, as I like to ask most people, how did you get into medicine? What led you to that? And I remember him sharing with me a very heartwarming conversation that he had with his dad out in the garden one day. And so, Dr. Dixon, in honor memory of the good Paul Harvey, tell us the rest of that story.
Welcome, everybody, and glad to have you on this webinar today. It was actually, my father was one of the original organic gardeners. Back when organic gardening was just a little tiny newspaper. And so most of us know organic gardening as a magazine, but it used to be a newspaper that he would get, and he was one of the original organic gardeners in the country. And we were out picking, beans at the time, and I was working on my master's program and moving into my PhD program, and I was venting with my father about how medicine completely ignores the importance of nutrition in wellness and in health in the medical field. And so as we're talking and I'm venting, he looked up at me and said, "Son, who makes the rules of baseball?" And went back to picking beans. And I thought to myself, is my father not even paying attention to what I'm saying? And I said, "Dad, I'm not talking baseball. I'm talking about nutrition and health." And he says, I know, just answer the question. I said, "Well, I'm a fan of baseball, but I don't know a whole lot about how they make the rules. It might be the umpires, it might be the owners, and maybe even the players have a say so, but it's certainly not the fans." And he looked up at me and said, "Sounds like you're a fan of medicine," and went back picking beans. And so the end of the story is I realized at that moment, and he was telling me in his country wisdom, that if I wanted to change the rules of the game, I had to play the game. And so I had to go to medical school. And that's when I decided not to finish my PhD in nutritional biochemistry. And I entered an osteopathic medical school in Ohio. So that's the story. And so if it wasn't for the wisdom of my father, kind of nudging me in the right direction, I probably would have become a PhD biochemist in nutrition.
Well, we, on behalf of probably the hundreds of your very happy patients, are glad that you decided to play the game.
Yeah, and it's been a nice journey. Whenever you can get the slide set up, I've done a lot in that career, and I've lectured both at the state level and national level, and taught at medical schools. So that's something that is passionate in my heart, is this whole nutrition journey that I've been on. But we're going to talk a little bit about the next evolution of where nutrition's going and where it's been going over the last 10, 15 years. And that's how does genetics interface with nutrition? And how is that changing the face of medicine? I think I've got a very diverse audience here today. So I think the first place I'm going to start is first with my background. My background is in dietetics and nutrition. And I mentioned I got my master's in nutritional science and had plenty of research to go and finish my PhD. But actually, I went back and defended part of my thesis while I was in medical school to finish my master's program because they really wanted me to finish the PhD. I did my osteopathic program, did a health policy fellowship in 1996. All this nutritional background started back in the late 70s, early 80s, and then did my medical training in the 90s and did a fellowship in 96 in health policy, board certified in family practice. I've got certificate of added qualifications in sports medicine, occupational medicine, geriatric, bone densitometry, and I'm a medical review officer. But my latest interest right now is being very involved in nutrigenomics and following the science of how does nutrition and genetics match up. It all starts with Hippocrates, let thy food be thy medicine and thy medicine be thy food. It's a famous quote. Most medical students know about this quote. In fact, most people know about this quote. But we lost our way in medicine. And this is one of the things I was complaining about to my father, that we don't use food like medicine. And that was frustrating me because food is medicine if used in the right way. And now we're actually breaking the code genetically and showing that to be true. So what are some of the lessons that we've learned through genetics and just medicine in general, or metabolic medicine? And that's number one, the body is a unit. If what we did in medicine is we tore apart the body and studied systems, and we still teach it that way. But the reality is the liver doesn't know it's not connected to the brain, and the brain doesn't know it's not part of the liver. The body is a unit structure, and that structure is designed to support every other structure and function in the body. And what happens, and what we now know, is the body has the capability of self-regulation, self-healing, and self-maintenance. And unfortunately, drugs do not play a part in any of those things, okay? It is the microenvironment that supports the structure and function of the body for regulating, maintaining, and healing the body. What medicines do is they get in there and initiate or support what the body's nutrition is trying to do, but it does not do it innately itself. So a nutritious diet forms the component parts of the structure, resulting in a functional system that is complexly interdependent and interrelated that results in you. And the coding system for that is obviously our DNA. So what's the historical roadblocks for integrating nutrition into healthcare? So I'm just going to go through this list. They're not necessarily in order, but lack of knowledge of physicians and nutrition, lack of resources in the doctor's office, lack of time during an office visit. If most of you have ever been to the doctor, we always seem to be in a rush because there's always somebody behind you waiting to see the doctor at the next visit. Lack of space in the office if you wanted to keep products, lack of confidence by physicians in what they know and how to apply it, cost and reliability of nutritional testing, cost and variability in nutritional products. And the reason is that nutrients support, cellular function. And the interesting thing, and I alluded to it a minute ago, was if your body is provided the proper nutrients, it can restore and maintain itself. And while exercise is good, and even medications are good for health, they do not supply missing components of nutrition that are the building blocks of the body. Drugs are not building blocks of the human system. And so they don't build functional units. What they do is they interact with those functional units. And that whole process of the ability of the body to try to repair and maintain itself is what we call aging. This is a great quote. I think it was in a Newsweek magazine years ago that I picked up on. And that's, what is aging? The process of cell death and inefficiency in repair and maintenance is exactly what aging is. The equation at the top is one I use with medical students. And what really affects aging is the toxins in our environment, in our surroundings, the genetics of your body, and the nutritional building blocks that you're feeding your body with, and how it allows the body to repair and maintain itself. I put a little epigenetic note down there at the bottom of the question mark. Genetics is one thing, and that's your actual DNA code. Epigenetics is, how does your DNA code actually respond to what we're doing to it? Meaning the foods we're eating, the drugs we're using. It's another whole lecture, but I do want to put that in the back of your mind because I might kind of come back to that a little bit later on in the slide set. and just touch on epigenetics, because when we did the Human Genome Project and we finished it, we thought we'd have all the answers. And the answer is we don't. What we found out is that your genetic code interacts with the environment. It's an intimate connection. So as the environment, for lack of a better word, communicates with your DNA expresses itself differently. And that's why identical twins never quite look identical as they age over time. They may look identical when they're young, but by the time they're senior citizens, there are distinct differences between identical twins in their outward appearance as well as their internal expression of metabolism. So, optimal nutrition, all components of nutrition at optimal levels without toxicity. Sounds easy, but it's not. Incomplete knowledge of most people, and physicians included, our busy lifestyle, and certainly the food industry is not designed for nutrition. The food industry is designed for what? It's designed for profit. It's designed for taste. When you talk about farming industry, it's designed for pest control and high yields. But very seldom are any of the food related industries that connect food to people are really focused on nutrition in general. And a big practice is what's called green harvesting. If you're not familiar with that, green harvesting is where they pick fruits and vegetables early, so because they travel better, and then they'll store them in large warehouses and infuse them with ethylene gas, and it makes them, age or rot a little bit, so their color changes, and then they ship them to the grocery stores. And when you pick a fruit or a vegetable green and don't let it ripen on the vine, they say that about 80 to 90% of the nutrition of the fruit or vegetable comes into the plant the last 10 days of ripening. And so if you're picking something 2 weeks early, you're just not getting that nutritional content that we're looking for. And so our nutrition is somewhat depleted throughout the country, and really the world for that matter now. We touched on the commercial growing, I already mentioned that. And then since the food supply is insufficient, you must use dietary supplements to get the nutrients that are needed for optimal health. Now, you may just think that that's a statement that I'm making, but it actually isn't. It's a statement that's based on science. And the science is quite old. Back in June of 2002, JAMA produced an article where they did a survey of the nutrition that individuals were getting in America. And they came up with a number of revealing statements that most people do not consume an optimal amount of all vitamins by diet alone. Then they made a statement, it appears prudent to take vitamin supplements or mineral supplements to fill in the gaps because our diet has changed so drastically in America over the past 100 to 200 years. And actually, the food pyramid, published the year after by the US Department of Health, I've circled in there that food pyramid and it was published in Harvard Newsweek, Scientific America, it was published all over. And if you see at the very top by the milk bottle, there's a little pile of supplements, vitamins, minerals, things like that. And what they were saying in that article and the USDA pyramid was to get a balanced diet, you must take supplements. But you never heard about that. It was never talked about on the nightly news. It was never, talked about when they were having interviews of people on programs on TV. They talked about getting your grains and foods and meats and fish and protein and vegetables in your diet, but they never brought up the topic of supplements. And there's a very practical reason why. The number one advertiser on TV, the number one advertiser is the food industry. And it would offend the food industry if they are advertising for all these foods and then turn around and tell the public that, oh, by the way, all the foods we're advertising are incomplete in providing optimal health and optimal nutrition. So they did it to protect their advertisers, so to speak. So true wellness acquired only through concentrated quality nutrients and not quantity. But how much is enough? Now, for years, I did what I called more of a shotgun approach, where I actually did the best I could with the knowledge base I had, because we were not doing genetic analysis 15, 20 years ago. I've been doing it for about 10 years now. But we weren't really able to really target people's nutrition. We did know that people's diets were deficient, and we would fill in the gaps of where we thought they were deficient. Here's a Newsweek article that's a few years past. I think it's about 15 years old, but they're talking about 21st century medicine and new treatments to treat cancer, Alzheimer's disease, diabetes, depression. And here's another Newsweek article that they came out with right around the same time. And it was Diet and Genes, the Science of Nutrition and Aging. And I like this quote that they put in to that article. It isn't just what you eat that can kill you, and it isn't just your DNA that can save you. It's how they interact. And that's what was probably one of the first public articles I saw when they were trying to grasp the concept after the Human Genome Project of what epigenetics is and how does the genetic structure, number one, tell us what nutrients we may need in higher demand than the next person beside us, but also how those nutrients interact with our genetic code to actually express it in a different way. And this is a very busy slide, but I just want everybody to kind of appreciate from the advent of understanding that there was DNA to the point where we can interpret DNA. And then all these articles in the late 1990s and early 2000s were coming out and making the connection that it's not just your DNA, because actually when I went to medical school, the actual statement in our class was there was no diet and disease connection at all, period. And that's partly why I was frustrated, because that was actually the USDA's statement when I went to medical school. And it was also the AMA's public policy statement that at that time, modern medicine felt that 100% of your health was determined by your genetic code, that your diet had literally nothing to do with it. Now, I'm glad to say that through many efforts, including efforts that I did and people within the health policy range, we've changed that. And now it's common knowledge to everyone, at least in the United States, that it's not just your genetics, it's that nutrition, your environment, what you're breathing, whether you're smoking, those things impact your health greatly. But back in the 1970s, that was not the case. So what did the Human Genome Project tell us? And this is data that was gathered years ago when they set up the geneticresource.org, which was actually the website that was set up for all the scientists to download their data into the repository to try to figure out the human genetic code. And during that time, it was estimated that every human being on the planet has approximately 20 to 40,000 genetic heirs in their genome, what they called heirs at the time. Half of your genetic code is from your father and half is from your mother. And so the obvious question that people should ask, and you don't have to be a doctor to ask this, you just have to think about it for a second. If that's the true statement, how are we still alive? How is the human race still functioning? And part of it is redundancy, and part of it is a repair mechanism that our body does. But I'm going to show you a little bit, and a lot of it has to do with efficiency and where our diet fills in those gaps of those heirs. So those individuals that have certain key metabolic heirs, that our diet fills in the gaps so they don't perish. Here's a quote, and I actually probably should have put this a little bit earlier in the slide set, but I liked it here because we're starting to talk a little bit about where genetics has gone in the 21st century and where it was at in the 20th century. Genomics should be considered in every facet of public health. We're talking about now, we're in the 21st century, both infectious disease, chronic disease, occupational health, environmental health, in addition to maternal and child health. This is a quote by Rodstein in the Journal of Law and Medical Ethics, of all things, talking about how genetics was going to impact it and how genetics should impact how we do medicine, but it's also going to impact ethically how we're doing medicine. And I like the picture, but predictions. So functional genomics is what the term I like to coin, because I like that functionality, just like functional medicine. Jeffrey Bland years ago was one of the early mentors of mine back in the 70s, and he coined the term functional nutrition and functional medicine But functional genomics is basically taking that functional nutritional aspect of life or functional medicine and applying it to the genome. And it should impact everything in our society coming up in the next few decades. But I want to show you where our predictions have led us in the past and how I think that this is going to be rapidly a lot more advanced and quicker to the market than what we thought the computer age would. This is out of Popular Mechanics back in 1954. They predicted that the home computer in 2004 would look like that. Now, I throw it up there just to let you know that our home computers in 2004 do not look like that. Some of them are actually handheld devices or tablets, and in 2004 we had all that technology. And so the reality is this: nutrigenomics and health with regards to understanding the genome and eating and supplementing properly, it's going to advance a lot faster than our predictions are, in my opinion. Dr. Collins made this quote, and this was his 50-year prediction in 2003. Okay, so 50 years from 2003. So he's talking 2053. We will have individualized preventative medicine care based on our own predictive risk of disease as assessed by looking at our DNA. Each of us will have had our genome sequenced because it would be cost effective at about $100. And this information will be part of our medical record. Because we will still get sick, we will still need drugs, but these will be tailored to our individual needs. Now, I think his prediction is great. I think it's a little off in time frame. We're now in the 2020s, and we've already met almost all of those goals, except for what I would say the majority of patients in the country do not have their genome sequenced and in medical charts. The cost has drastically dropped. And I would disagree with the fact that we do have nutrigenomics with regards to and pharmacogenomics with regards to drugs affecting people's genome, but it's not as tailored as we'd like it to be yet. But the reality is the nutrigenomics is advancing much faster than what we call pharmacogenetics. And so we're moving where we can actually advance age and longevity and wellness to where people will not need as many drugs or drugs as soon as they would have needed them if they had not done proper nutrition that was genetically targeted. So how do you sequence the genome? Well, we know how to sequence the whole genome, but the interesting thing when you're talking about drugs and metabolism and genetics in general, 99.1% of all human beings on the planet, their genetic code is identical, which is, number one, amazing to me that a 0.09% of that variability is expressed in all the variations of all humans on the planet. So we are really only one race, not to divert into a political realm of divide and conquer that we see around us all day long. But this is the unifying message that I think we should carry as healthcare professionals to everyone we meet, that everybody on the planet is 99% identical, and that the class wars and the race wars and the things that we're doing in our society right now are not medically founded or justified. Back to the lecture slides. With regards to how do we sequence the genome, it makes it a lot easier on us and our testing models because we really only need to look at that 0.9% of the genetic code that we know has the huge variability from individual to individual. And more importantly, we're only really wanting to really address the genetic variants that are what we call actionable. Okay, what do I mean by that? And I might have a slide on this, but I'll go ahead and explain it now. But actionable genes are things that we can actually do something about. I really have no desire to do something about somebody's eye color or their hairstyle or their skin color. As a clinician, I'm looking for those genetic variants that I can do something about that would improve someone's metabolism improve someone's longevity or health, and improve their functionality or their efficiency maybe of their biochemistry. So the number of genes that we really have to look at are not the billions of genes that we have, but we've got narrowed it down to thousands of genes that we need to be able to look at to make those distinctions, and then look at even less of those to actually which ones are more actionable and which ones are not very well actionable, at least not at this day and time. Some terms that I'd like you to all to start to get familiar with, because I really encourage you to look into genomics in general and how this is changing healthcare in America and healthcare around the world. So a genome is the totality of the organism's DNA. Genomics, the systematic study of multi-gene systems, okay? Nutrigenomics, as the name says, it's what genes are really have interplay with the nutrition and the diet that we're eating. There is dermatogenetics, and those are those genes that have to do with the aging and the health of skin. There's pharmacogenetics, which we focus on right now, and I do this quite often in my office to figure out how people metabolize drugs. And it really goes farther than that, because those same systems, like the cytochrome 2D6 or cytochrome P450 system, they help you digest and detoxify foods and toxins in the environment, not just drugs. And so it actually is much more broader in my mind, the pharmacogenetics aspect, than just talking about drugs. We're talking about detoxification. We're talking about how do you break down nutrients that could possibly be toxic if you didn't break them down, things like that. And then companion diagnostics is basically genetic testing, which predicts a drug's potential efficiency. We do that with some of our cardiac drugs now and things. There are certain people that will respond abnormally to certain blood thinners if they have a condition called AFib and they need to be taking certain blood thinners. We now can isolate which ones would be actually better for that patient and which ones might be more dangerous. A little basic science, and we won't delve too deep into this, but what we're looking at in genetic mapping is what's called a SNP variation, a single nucleotide polymorphism. It's a small variation in our DNA code where just one of the nucleotide molecules is substituted for another. And that one substitution accounts for most of the human genetic variations on the planet. Now, I want to clarify something, and this is for a lot of the people that may not understand this. In the early days, we called these genetic errors when we were doing our research. But the reality is that they're probably not a typical genetic error or a genetic mutation in the sense of a mutation that would cause a full-blown disease. We do have some of those mutations, those spontaneous mutations in the genetic code that cause rare diseases, but most of these are just variations within the population that make different people have expressions of their genome in a different way, makes them more efficient, makes them a better athlete, or maybe makes them even more intelligent than the next person. And in our society, that may not be a nice thing to say, but it's an honest thing to say. Everybody is, for lack of a better term, wired differently. Most people understand computers. And so if your wiring and if your hardwiring is one thing, and then your programming is another, and your genetic code plays into your hardwiring of how things work in your body, whether that's in your liver or whether that's in your brain. It's the way science is. And then the soft programming is how you treat that with the environment, environmental exposures, your diet, your exercise, and how you supplement and fill in the gaps. This is a slide, I kind of already explained this, talking about actionable genes. So what I'm interested as a clinician is what SNP variations have actionable things that I can do for the patient that will help with their personalized health, help with their nutritional health, help with medication prescribing, and even in a cosmetic way, help with their skin health, because there's a huge market for people wanting to stay. We're living longer and we want to stay younger. And so this whole actionable gene realm fits into that. There are some things we can't do anything about. And in my mind, I just put that to the backside, and I want to focus on what can I do to bring people's optimal health to the forefront and keep them well and healthy. This is just a lead in for what we want to talk about. So where are the areas in what I see human health? These SNP variations actually impact the body, and impact the body that can help us diminish, disease and help with their wellness package for a patient to keep themselves well, keep their immune system well. In the age of COVID, everybody's trying to figure out, how do you stay well? Because we realize, especially when we had no drugs in the beginning, I mean, now we've got multiple medications we can use for treating COVID-19. But in the early stages of this, when we first thought that up to 20% of the population of the planet might die from this virus, it was a really scary time. And what we did know back then, when it first came out, all the functional medicine docs were talking about, well, the main thing we need to do is keep people's immune system functioning properly, because historically we know that if you have a functional humoral immunity, you can pretty much beat any virus that is thrown at you. It's those that have a dysfunctional immune system that fall prey to viruses. So how does SNP variation mapping? It's antioxidant stress, how you handle that, environmental challenges and detoxification, cardiovascular health, immune health, as I touched on, neurologic health, pulmonary health, vision and eye health, and bone health are only a few of the areas that we have now opened up. And actually even exercise physiology is breaking into this area and finding out that certain exercise routines are better for one person. Like you may do better with aerobic exercise, and some people do a lot better biochemically and genetically with intermittent training kind of routines. And all of this is starting to unfold, and it's a pretty exciting time to be looking at that and adding that into people's wellness packages. So these individual formulas, what we do is we analyze this, and then we set up what we call boosts. So for one SNP variation, we may have a boost, and that boost may contain a number of different things. But what is that boost designed to do? It's designed to mitigate or compensate that gene polymorphism. The polymorphism term is just that one base pair change, okay? Because it's polymorphic, meaning that there are multiple ways that one SNP variation can be throughout the population. This is what we're using and we're calling designer nutrition, because sometimes you mitigate it as in turning that SNP or that gene on and off. And sometimes you can't turn a gene on and off, and I'll give you some examples in a minute, but you can, because you know it exists, you can compensate by adding more things to allow for the body to compensate for that lack of ability to do what that gene is supposed to do. So these boosts on an individual formula, it all is dependent on what your genetic analysis shows. So some people may only need a few boosts in their supplement, and other people may need multiple boosts. And once again, these boosts are not meaning that you're genetically erred in some way. You biochemically function in a different way. And let's say you may need a certain form of B12 because you can't metabolize it to its end methylcobalamin, and you can't utilize cyanocobalamin. So you have to supplement with methylcobalamin to get your biochemistry to optimal functional status. And here's one that I like to show because it gives a very practical way of looking at it. This is the MTPR gene, which is designed to help with the processing of homocysteine and in multiple other pathways within the brain, the liver, and muscle cells. But here's what I really want to point out, is this one variation, one nucleotide base change, and you can see the C to C or C to T or T to T. And what I want you to see is that this encodes for an enzyme, and that enzyme, literally, if you have the CC version, that enzyme system is 100% efficient. 100% activity. When you have one base pair change, it goes down to about a third of its efficiency to 71%. And if you have 2 base pairs, you can get down to about only a third of the efficiency of somebody that's effectively running at 100%. So this goes back to what I talked about, those genetic, what they called errors in the beginning. They're really SNP variations. They're not errors in my mind anymore. But when you're 100% efficient, you can pretty much eat raw things and eat anything you want to, and you're doing pretty good. Now, this is just one example. And if you get down to 75% efficiency, you can usually do pretty good on your lifestyle, and you don't have to be real meticulous about what you're doing with your diet. But if you have a number of SNP variations that require that your efficiency in your metabolism drops to only about 35%, that's where the system breaks down in repair and maintenance. The body is not able to keep up. They can't repair and maintain the functional structures within the body to keep the cell alive. And if you can't do that, that's what we call aging. And this is how this whole mechanism works. Every SNP variation plays into one of these models. And it's not just a few, as we mentioned earlier on the early slide. People have 20 to 40,000 of these variations in their body that are very well possibly could be impacted by the way you're eating and the way you're living, and whether you're smoking or drinking too much or whatever, not exercising enough. And all these variations play into your optimal health for optimal performance and optimal longevity and health. So jumping back to this one, so what the researchers say, and I put some references here for doctors that want to look at different references. And this data, as you see, goes back into the 1990s. So this is not new information. The problem that I see is we've got tons of information. I'm friends with multiple deans of multiple medical schools around the country. And when I approach them about talking about this stuff and educating our young physicians about this kind of a topic, in topics in nutrition in general, their attitude is, Jerome, I know you're on target. I know these things, are important, but we've got a job to do. And our job to do is to literally focus on what we need to teach them to get through board. Because if we can't get them through boards, they won't become a doctor at all. And they're just going to have to learn this stuff after medical school. And so it really becomes a volunteer program for clinicians out there. And so for those people that are seeking out a doctor, I really encourage you to seek out doctors that are open-minded to functional medicine and functional genomics, and start to look for those doctors that are doing the advanced care that we know is possible and able to be done in the United States today, but is not being taught at most major medical centers or even in residency programs, just because of the time delay and not having enough hours in the day to get this information in. It's not that they don't want to teach it, and I'm close friends with these people. It's just a matter of time. There's not enough time to fill people's brains with this. So they have to have an interest. They have to designate the time themselves. So the MTFHR gene, this is where it impacts. Homocysteine levels, we've heard a lot recently in the literature about cardiovascular health, especially when homocysteine levels are high in women. It's a significant risk factor for cardiovascular health. But when you really look at the biochemistry research, it affects cerebral vascular health, peripheral vascular disease, really all vascular diseases. It affects liver and the kidneys on how we detoxify our body. Thyroid function is affected by it. And even our mental health, from depression to Alzheimer's disease. If you can't perform this function and you don't supplement the methylized form of folic acid into your body, then you can't function at optimal levels. We think that this is also definitely connected with spina bifida. And we load people up on folic acid. We've done it for years. But now we're realizing it's not just plain folic acid, because some people can't convert folic acid into L-methylfolate, which is what's needed to cross the blood-brain barrier. And if you have a dysfunctional enzyme system on the MTFHR gene, you have to eat ample quantity of L-methylfolate to get into the brain, so you can actually slow neurodegenerative processes in the body. The MTRR gene, methionine synthase reductase, is it's a very close cousin. It has to do with transforming homocysteine as well, back and forth. And It helps your body clear that high homocysteine levels, because we know that cardiovascular wise and mental health wise, high levels of homocysteine are not good for those conditions. But the most research that you can find readily available out there is on the cardiovascular health of an individual related to homocysteine levels. We hear about lipids, and how that affects cardiovascular disease, everything from LDL to total non-HDL cholesterols. But what I want to bring to your attention is a lot of docs know about apoprotein B, and it's the protein coat that makes the low density lipoprotein the more dangerous form of lipoprotein. This is a gene that doesn't turn on when you're young. It gets activated as we age. And what's very interesting about this gene is we can attack it two different ways. There are certain nutritional things you can do to mitigate that gene from not turning on, so it turns on later on in life. I can personally remember when mine turned on. I was around 40 years old, and my LDL cholesterol went from 70 to 140 in 1 year, and I changed nothing in my diet and exercise routine. It's just that this gene turned on. This gene is also the gene that we actually are targeting with a lot of drugs when it comes to the statin drugs. But there are nutritional things we can do to kind of keep that gene from turning on. And then there are nutritional things we can do, obviously, even once the gene turns on, to help mitigate and to compensate for that gene being active. This is an interesting gene that also plays into lipid metabolism that a lot of people don't know about, what I call the PON1. And it is an antioxidant enzymatic system that actually is on the surface of HDL and LDL molecules. So it protects those molecules from oxidation, okay? Free radical oxidation. Most people understand what free radicals are not necessarily good in the body. In fact, the free radical model was thought to be the main thing in the main way people age. We've found out it is a component of aging, but it's not the holy grail that we thought it once was. But on the lipid molecule, if your lipid molecules are oxidized, they become much more atherogenic in creating what's called macrophage fatty streaks, which is the very first step in the process of atherosclerosis in the body. And so this variation in this one gene can have a 10 to a 40-fold difference among individuals and how atherogenic their actual lipid molecules are. And this is one of the keys that I think, I've not been able to prove it, but when you see those individuals that have these high LDL levels and they've really never done anything about it, but they still live in their 80s and 90s, and you're scratching your head on why haven't they had any cardiovascular problems, and they have a LDL of 160 or 170. My feeling is this gene is very active in a positive way at making their LDL molecules not as atherogenic. And so they have the ability to live longer because they don't even start with those fatty streaks because their lipid molecules don't get oxidized. This is one of my favorites, the VDR gene. It's basically your vitamin D receptor gene. And the basic scientists are saying that this one gene accounts for 75% of, for lack of a better term, osteoporosis or weakening of the bones in the general population across the planet. Now, for years, we said it was postmenopausal changes, and that does play a role. But what really plays a role is this gene as the gene that allows you to absorb vitamin D from your gut or off of your skin once you convert vitamin D3 on your skin and reabsorb it, because you have to make all the sunlight in the world is of no value to you in making vitamin D if you can't reabsorb the vitamin D that you made into your body. This gene changes the way that you absorb vitamin D. And if you have a single SNP variation, in my experience over the years of treating thousands of patients that have this, is that it takes about 500 a day of international units of vitamin D to maintain their normal vitamin D level above 32. And if you have a double SNP variation, it can take up to 10,000 a day. Now, historically, when I was training, people would say that 10,000 a day was a toxic level of vitamin D and everybody would get toxic on that. That just hasn't proven out to be true in science. People can take, depending on their variation of their vitamin D receptor, high doses of vitamin D and they'll never get toxic. It's extremely, I joke with my colleagues, I've been trying for 30 years to make people toxic on vitamin D, and it's not an easy thing to do, especially when you know what their genetics are. CYP 11B2. And there's actually a number of these CYP genes, but we'll focus today just on one of them, the aldosterone synthase gene. This is a gene that actually plays a role in blood pressure management. And different variations of this SNP variation will make you much more susceptible to having early onset hypertension and high blood pressure. And there are definitely nutritional things that we can do to help mitigate that process and allow people's blood pressure to be managed better with diet and nutritional supplementation for many years before they need to actually be on medications. Now, this one gene doesn't guarantee that you won't be on a hypertensive medicine as you age, but it does play a role, and there are things we can do to slow down that early onset of hypertension, or if you have hypertension and you're on medications, by supplementing properly, it literally makes your medications much more efficient at working. And so I've learned over the years, as I get new patients in that are on a lot of medicines, and I start to change their nutritional supplementation and start to address these issues, we're able to at least back off on some of their medicines. We may not be able to stop them, but we can obviously use a lower dose, because as you change the structure of the body, you change its function. And as the function changes, medications inevitably become much more efficient at what they do. And so you need less of them. GPX1, which is your glutathione peroxidase gene. This is glutathione. You have three key endogenous antioxidants: glutathione, superoxide dismutase, and CoQ10, cytochrome P50 system. And so those are the three endogenous antioxidants that are super antioxidants. We can eat antioxidants till the cows come home, but if you have dysfunction in your endogenous antioxidant system, if we don't help support that, your antioxidant system will not be efficient, and that affects every organ system in the body. And this is one that we can actually help, mitigate it by helping the body manufacture and that enzyme system, make it much more efficient, and allow it for the individual to actually manufacture much more glutathione on their own. But we can also support them with the building blocks of glutathione so they can actually make their glutathione better. I guess one of the biggest things that I notice when I take residents to the office and students through the office, they all are interested, in what I'm doing. But their comment to me is, Dr. Dixon, I want to do what you're doing. I just don't have the knowledge base, and I just don't have time to do it. What genetics allows us to do as a clinician is, through an easy oral swab genetic analysis, we actually can get the raw data that we need to help individuals supplement more targeted. And there are companies out there that actually help you with that. And so it makes it easier, in my mind, to allow clinicians to bring nutrition into their practice, because these are all individually formulated products. So it's not, you don't have to keep anything in the office. You just do the test and recommend to your patients, just like you would anything else that you're doing with a test. You usually do a test and you're going to recommend something, whether that's just something as simple as an iron studies, and you're going to recommend some iron. So this allows us to take that same approach to these different genetic SNP variations that can have great impact on people's physical health and mental health. On some of these, the MMP1 boost is a collagenase enzyme that, it's interesting. It's kind of, sometimes you think about these enzymes not working efficiently. This is an interesting one where this enzyme actually, when you have a SNP variation, your collagenase enzyme can be much more active at breaking down collagen. And so what you literally have to do is we supplement with the boost there to strengthen your collagen, giving the building blocks of collagen and the free radical protection of collagen, because your body genetically is trying to break it down much quicker, which leads to a lot of inflammation in the muscles and joints of the body. The MTPR gene, we talked about that, and betaine, hydrochloride can help, and choline, They're helping with regards to that enzyme system. And you can also, L-methylfolate fits into there. It's not on the slide. And that helps reduce homocysteine, your MTPR gene. Same thing. We can help enhance the body's ability to produce more glutathione that activates that gene, and it helps protect people's cardiovascular health.
There was a question that came in, and it is, how does a patient take advantage of this knowledge of their unique gene influence?
Okay, so if you don't have a clinician that's doing that, there are a couple companies out there. There's one particularly that's probably leading the pack at offering this technology to just the general public. There's two approaches. One, you get a genetic analysis, and then there are multiple companies out there that will actually recommend from their product line that you need this product, and this product. And there is one company out there that actually is individually making individual products that I know of, that literally is designing a product just for that one individual. But we do have resources available for people that are watching this, that we can guide them in their discovery. But there are a number of companies that do genetic analysis and either match with their straight, what I call off-the-shelf product line, or there's a company that actually will customize, design your product for a reasonable price, what I think is a reasonable price, because when you're talking about some of the ingredients that are in the products that they're creating, like let's just use L-methylfolate. L-methylfolate, my wife has that one SNP variation. If you just want that SNP variation, just to treat that one ingredient, to buy L-methylfolate on Amazon will run you about $1 a pill. So as you add up these nutrients into somebody's formula, it gets expensive real quick. My example to patients are 5 years ago when I was doing this, I was sometimes recommending people take up to $200 to $300 a month on supplements. And it just is not feasible for some people to do that. So it was a very high-end kind of consultation practice. But now with some of the technology that's out there with regards to these individual products being able to be formulated in a cost-effective way, it's getting down to a cost of people can do this for $2 to $3 a day, which is a lot cheaper than what we've ever been able to do. And I anticipate as time moves on and the market moves on, that's going to get cheaper and cheaper as the technology and understanding and competition plays into the whole picture.
So bottom line for those on here listening is that understanding a person's unique genetic code gives them a very powerful tool to help them make choices that are best for them. And you mentioned a word earlier called epigenetics. So in the last couple of minutes, let's circle back around to that.
So epigenetics for me is how do we apply the information of our genetic, whether it's 23andMe or whatever, wherever you get your genetic information from. And how do you take something that will interact with that information in your body and express your genetic code in a positive way, not a negative way. Now, epigenetics in general is neither positive or negative. They look at both things, what things we do to make a negative impact on our body, like smoking and causing a free radical cascade in our body. And what do we do that we eat and that turns on and off genes? We now know that your diet affects not just turning it on and off in a gene, but actually serial genes over and over again. And one gene affects another gene, affects another gene. The other thing that we know is that we're getting data that shows that these changes in the epigenetics of your genetic code doesn't just impact you, but it impacts your offspring. There's some data coming out now that the diet of the grandmother affects the health of a grandchild. Now, I know that's hard to grasp your head around, but the only way we can explain that is that the epigenetics and the way the mother eats affects her children, and literally the genetic expression goes on for a couple generations. Now, here's my fear. If that's a true statement, and our grandparents and our great-grandparents diet affected our health and the health of humanity, and the way the diet has changed over the last 100 years, being worse, that means for us to clean up the health of America and the health of other countries around the world, it's not a one generation fix. It's not just that we can fix it today. We got to get people's diet changed now, because it will affect the next generation or two of the planet. And I fear that the diet of Americans, the majority of them, is not a very well diet. And even if, you can patch it some by having a lousy diet and doing good supplementation, that's doable. It's not optimal. What's optimal is we teach people how to eat a good whole foods diet, go back to what our grandparents were doing, and then on top of it, fill in these micronutrient gaps to make sure that your genetic code expresses itself to its full potential. And then that affects the next generation being even healthier than the prior generation. Because what we've seen in the last generation, as all of us know, is that our generation is not as healthy as our grandparents' generation or our parents' generation. And unless we turn the corner and start to educate people and educate society that you can't eat food that are full of chemicals, that we don't know what's been happening to our bodies because of them, because there's no studies to understand. All we have is epidemiologic studies that are showing that our society is a lot less unhealthy today. We have a lot more autoimmune diseases and weak immune systems and abnormal functioning immune systems. And when you really talk seriously about it, the only thing that we can say has changed in those hundreds of years that this data is being collected is the way people eat, the things that, and the amount of toxins that we'll be exposed to. In most homes, you have more chemicals in a modern day home. There are more chemicals that you're breathing in from just the cleaning agents that you're using and the detergents that you're washing with than there were in the chemistry lab of a chemist in the turn of the 1900s.
That's pretty scary.
It's a scary thought. And I really want to encourage people to be actively voicing their opinion that we need to move back towards a diet that is healthier, and it can't be all processed food, and it can't come from all big manufacturers. I encourage people to support their local farmers and their local farmers market. And because if we depend on all corporate farming to supply all the nutrition in the world, it's just not going to be healthy nutrition, and it will affect and impact our genome from not decades to come, but hundreds of years to come, because it's actually changing the expression of our genetic code in a negative way, not a positive way. The good news is you can take a cancer patient that has obviously expressed their genetic code in an abnormal way and change their diet, change their nutritional supplementation, and get drastic improvements in their outcome for their cancer treatment. The days of saying that you shouldn't supplement during therapies, for anybody that knows the data, is wrong. Now, there's a couple studies out there that you shouldn't just supplement beta carotene, or you just shouldn't supplement a vitamin mineral made in the lab or a vitamin supplement made in the lab. But if you're moving towards a whole foods diet, I don't know of any oncologist that will tell their patients to stop eating good food. And in my mind, supplements are good food as well, because most good supplements are just food extracts. And so you can use those actively in the treatment of disease. They're not changing the disease. They're not impacting the disease in a direct manner. They're impacting the disease by making people's biochemistry more efficient and their functional system more efficient. And with that, I'm going to end our talk today. And I thanks everybody for getting involved, and stay involved with this organization, because we're planning on bigger and better things.
Thank you very much, Dr. Dixon. And Cassandra, I will turn it back over to you.
Thank you guys. So much great information. It sounds like we should have a follow-up.
We might have to.
Yeah. Everyone registered today will receive an email within the next 7 to 10 days, including a recording of today's webinar, as well as the contact information that was included in the slide deck. Look forward to next month's webinar, Genomics, the Future of Medicine, with Dr. Sharon Hausman-Cohen on May 4th. Thank you, Denise and Dr. Dixon, for your time and really informative presentation. Have a wonderful weekend, everyone.
Thank you.